My name is Kalani. I'm a student physical therapist at Midwestern University. And today we're going to be doing another skills check video, but we're doing it on the hip and the knee, so you might want to pay attention. First, we're going to start with a leg length discrepancy measurement. So we're going to measure to see if Jonah is normal or not. All right, so first I need you to put your knees together, bend them, and I want you to bridge up. Okay, good. And come back down. And I'm going to manually extend your legs just like this, so we have a neutral hip, because we don't want to measure you irregular just in case. Okay? So I'm going to find the bottom of the ASIS. Is that okay?
Yep.
Is it okay if I go in?
Yeah.
Okay. So about there. I don't know if you can see that, the ASIS, and I'm going to measure to the bottom of the medial malleolus. So we'll go right here in centimeters. Okay. Anterior, superior. All right. I'm going to go all the way down. Jonah has about 86 centimeters on this side, and then you can see me better on the other side. So find the same thing on here. Measure. He's about, wait 1 second. Oh, there it goes. He's about 86 centimeters also on the other side. So that would be normal. Okay, so next we're going to be performing the Scour test, which this test is to test any intra-articular pathology, so like osteoarthritis, hip impingement, internal impingement, and a labral tear. So what we're going to do now is we have Jonah here laying supine, and my table does not go any lower. So I'm going to try and get proper body mechanics on this stool that I have. So we're just doing our best here, okay? All right. So we're just going to put him up into this capsular movement. We're going to abduct and go into flexion. I'm going to apply an axial compression here. I'm just going to push through your hip. How's that feel?
Yes.
Feel okay? And now I'm going to move it through. I want you to tell me if you have any of your similar symptoms that you walked in with, okay?
Okay.
So we'll start out here, go all the way through, and back. Anything?
Just soreness. I hit a tasty leg day yesterday.
Okay. All right. So this would be a negative test. Okay, so now we're going to be performing a valgus stress test. This is to test instability and a rupture in the medial collateral ligament. So we'll just do it one-sided, but normally we would want to compare it both sides. So what we're going to have Jonah do is lift his leg passively. I'm going to use my hip to make that valgus force going medial or inwards, okay? So I got you here, and I'm just going to go this way, and it's coming right back, palpating that ligament. No instability, so he is all set. All right, while we have Jonah laying down, we're also going to attempt a McMurray's test. So this is also for lateral and medial meniscus. For the medial meniscus, we're going to go all the way up into flexion. We're going to externally rotate at the tibia, and we're going to put this valgus force into the side of the knee and go down. So we're just assessing for recreation of symptoms here. And then for a lateral meniscus, we would go internally rotating, and we would also go into flexion, creating a varus force coming down. Pushing down. You got very mobile hips.
Thank you. My mom says I have good joints.
Wonderful. And that is the McMurray's test, and Jonah would be testing negative. Okay. Okay, now we're going to be doing an anterior drawer test. So this is going to test the stability of the ACL ligament within the knee. So I already have Jonah positioned in a flexed position. I'm just going to put some force on his foot. How does that feel?
Feels good.
Okay. Feel okay? Not too much?
Nope.
So that this stays in place. And then all I'm going to do is pull towards me. So just like this. I'm just assessing to see if there's any excess movement from the tibia and the femur. And it looks like this is pretty stable ligament because it just bounces right back. Any pain?
Nope.
All right, this would be a negative anterior drawer test. Okay, so we're gonna assess patellar mobility. So just like your kneecap, how it moves. Normally we would assess this if we see a flexion or extension range of motion deficit in our patient, if they're reporting pain, or if the knee has been immobilized for an amount of time. So I'm gonna push your kneecap this way, this way, this way, and that way, okay? I want you to let me know if you are experiencing any pain or any symptoms, all right?
Got it.
Okay, so we're just gonna push it that way. Just making sure you can see me that way, that way. Superiorly, not as much going up there, and inferiorly. Superior, oh, there it goes.
Looks like the Beatles and the Mummy.
Gross. But you're right. Medial, lateral, up and down. And he seems normal.